Good morning. My name is Joie Glenn, and I'm here today with Sylvia Talkington, who wrote the book Home is Everywhere. And I read the book and was delighted by the book and intrigued by the book and decided that I wanted to get to know Sylvia a little bit better. So I organized and we organized together this opportunity to get to know about the book, as well as to get to know Sylvia. And so Sylvia, good morning to you in Denver, Colorado, which is beautiful today and sunny.
Mhm.
And my first question is a burning question for me. And that is throughout the book, I always wanted to come to you and say, why home care?
Sure. Good question. I think many of the nurses out there who've gone into home care actually ask that same question. It started just as many of our jobs did over the years. I had been working in critical care, followed the current thought leaders. And in the 1980s, the trend was called futurist. And there were a number of predictive futurists that joined in the call for what shall we do in the future about the aging boomers, baby boomers. And Ken Druck was one that I continued to follow. He was one of the first called futurists, and his little enclave of futurists began to talk about what would it look like in the future days with the aging. There would be homes on aging, smart homes. There would be people who would want to stay at home. The current phrase is living at home alone or with home care. And it was curious to me. I lived in the world of critical care and hospital care. I also found in critical care, in ICU and the other critical care areas, that I was sad by not really knowing where what these people were like when they were in that ICU bed. So I thought it's time for change. I was beginning to listen to what the futurists were saying, and I thought, okay, let's change it up here. And I found a position as a visit nurse at a hospital-based home care system. Many of them were out of the hospital-based systems. And so I did visits for a while and thought, oh, this is it. I never knew what happened to my patients in critical care when they went home. We handed them notes about their medications, and that was it. So I began to really get involved with home care and visits. And then it progressed from there. At the hospital, we were based out of the room there, and across the street was a home-based home care, which that was the timing when there were all these iterations of for-profit, not-for-profit. So home care was beginning to bloom well, and they advertised for a professional director of nursing. So I applied and had no idea what I was getting into, but quickly became completely involved in what was happening with regulations, what was happening with all the rules from the 1965 home care benefit. Just talking a little bit about going from critical care of 25 years to what now is about, oh goodness, maybe 30 years in home care. Did that help a little bit?
Thank you, Sylvia. That was my burning question as I read your book and loved your book, as I said. And so that gives me that answer in terms of how did you end up in home care? And I'm so glad that you did. So let's just dive right in now. And so how did Home is Everywhere come to be?
Sure, sure. The circuitous way. I had also been in academia for a number of years, both at the University of Colorado Health Sciences Center. I motivated there to do home care studies. That university research center was a well-known leader in long-term care research. And then at that time, with the way that home care was developing, they were doing home care studies. So I had written often, I taught often critical care courses, wrote for National Jewish Hospital then, because I was writing all of their patient brochures and all of their scientific articles from studies there. So I guess I was an author all the time. I was a writer, bottom line writer. I began to write for a business, my business called Health Right. So main was that I was a writer, an academic writer attached to various research institutions. I did ghostwriting for physicians for their journals. So writing was there. The other key part was that I was also restless with those things. I had created all the manuals for CMS, Centers for Medicare and Medicaid, at the direction of the university's team, of which I was a part. But really, to answer your question, it was Seattle that did it because I wanted to branch out. I always wanted to write something creative, and I dabbled in simple stuff in the public area. But Seattle in 2014 was the convention of the Association of Writers and Writers Programs. I had not been able to attend a writer's program before, and that happened later. But Seattle, I'd already moved from critical care and all the associated writings that went with that, and home care. And I thought, I'm going to try creative writing. Yes. So now I had this whole backlog, as it were, of stories from home. Some of the stories in the book that you read, the various stories, happened then in 2014, and I had already drafted probably a third to a half of the stories that are in Home is Everywhere. So I thought, okay, you better get yourself to some creative writing education. And I was there, loved it, because I'm an avid reader in the public realm and private realm. And I went into the exhibit hall, and there was a woman from Excelsior University writing program. And that's in New York, upstate New York, Excelsior College. Um, she had a book that she promoted, saw published, where there were 7 authors. And at this time, she had recruited them. They had come to her. And their topic, they wrote the book about nurses who got deployed to Iraq. So I thought, this is really keen. It's the voice of these nurses. It was their story about how they were taken away from the normal life of intensive care and so on, and create their stories. So that leads to the next part about how did home care come to be, is stories. I'm a storyteller. That's, if I've learned nothing through these 7 years of putting it all together, um, I'm a storyteller. And they were telling their stories, and I thought, oh my, now you're totally immersed in home care. You have been to hundreds of homes. That deserves a story too. So I met with, asked if I could meet with her. She had one of the authors with her. So we went from the exhibit to dinner of like 4 hours. And we were on the verge of, and did complete an initial an initial kind of like it wasn't a sign up for that they would do the book, but she was very interested in it. So I sent her drafts for quite some time. That was February 2014. In April of 2015, I kept going with the diagnosis of breast cancer. And it got to where I just couldn't keep up with the timelines that were in our contract that we originally had put together. So, um, but I never gave up. I remember doing radiation and looking up at the nurse there. They all became my friends, as many people know. You become very attached to your healthcare providers. And I said, I'm writing a nursing book. And she said, oh, how nice. Well, I'll tell you that just 2 months ago, I had a follow-up mammogram and I handed Home is Everywhere to that wonderful nurse that saw me through. So, first and foremost, I have lots of stories to tell, and they're all about the people I cared for in their homes.
Thank you, Sylvia. Thank you especially for sharing that your diagnosis with us, because I know that sometimes can be difficult to talk about. But thank you for sharing that. And once again, we are the lucky ones because you are a storyteller, and throughout the book, that's what comes across. And I'm so glad that you took it to the next level and connected with the right people. So let's go just a little bit beyond that in terms of, because we're the passionate ones about home care, and we know home care, but why do you see Home is Everywhere is for all readers, not just those employed in healthcare or home care? What is it about that you see?
I see it primarily, and that was a guiding factor too in the actual creating of the content, is at the time that I began, it's still steady. They haven't done a lot of numbers recently. Um, but 1 in 4 Americans will come into contact sometime or many times during their life. It could be as a patient in home care. It could be you're caring as a caregiver for a loved one, a neighbor, a friend. It I don't know that it would appeal or have the same appeal for someone under 18, but anyone over 18, many young adults have grandparents who have had home care. I see grandchildren here in my adult building that are assisting a home care nurse walk their uncle, grant, best friend, aunt, and so on. So I think it belongs to everyone. Not only those employed in healthcare, but I think even under what the things that we hope for this video to achieve, it introduces to people of healthcare and non-healthcare, and it's important because if we take that step back to the futurists, home care is healthcare of the future. We've already moved on to the telehealth piece of it. And, that's a particular kind of extension of home health care. There are nurses manning the call lines and so on. I understood the other day from a colleague in home care that they're hiring home care nurses to man the telehealth and the call centers because they know what it's like in a person's home. So I do. I really do think that we have to move forward with that. Um, and maybe it's not characterized this way, but the soft side of home care. There's a chapter you may recall about a person's spot, a home care patient's spot. And a spot is about that easy chair that home care nurses go into in an apartment or home, and their person has a place where they sit all the time. It gives you hundreds of clues about how they're feeling, how their strength is. It tells you the story of that person. So the soft side that I'm referring to is that the book to me, they're all friends in the book. I know those characters by heart and they were actually real. But the soft side is to show the humanity, to show the compassion that is possible. Everyone has a story. Everyone has lived. And yes, there are people who will succumb to being hoarders because their lives have treated them so terribly. And so they have all the diseases that go with it. So I think if I could do anything, it would be to bring that soft side of a person's story through the eyes of the nurse as well. Does that make sense?
It certainly makes sense, and thank you for sharing that. I think you have already stepped into my next question, but perhaps there's something else that you want to tell us in terms of what were you trying to achieve with this book?
Mm-hmm. If I could make people say, oh goodness, you've written a book now, and so everybody will want to read it. Well, you, as an author, you quit saying that. No, everyone doesn't want to read it. We hope that they will. What I was trying to achieve, and what I say often, is if I could make one person smile, the reader, a reader smile. If it could share a story that helps them understand a person's life and what it was like. And kind of buried or hidden in that is empathy. The stories can create a sense of empathy. We read these days widespread the sentiment about how can we understand what people are feeling? How can we step in their shoes? How can we survive this time of COVID and beyond? And what I was trying to achieve is in all of this, I wanted to just tell the stories of those at home with compassion, real stories that really happen every day in thousands of homes. And that was just it.
And
Still,
and
still want to do it.
and I can tell you as the reader that you definitely I definitely smiled. I definitely giggled. I definitely cried. And I certainly had empathy for many of the experiences that you had and understanding them because they're real to home care. So thank you so much. You did achieve what you set out to achieve. So moving on and going forward to take it to the next level, let's have you talk about where you see this belonging. Are you seeing book clubs? Are you seeing home care businesses adopt this? What's your opinion on that or your view on that?
I'll tell you that the wonderful experience of meeting you. And we had this conversation, had a long conversation a week or so ago. I have found that there are more places it belongs. In answer to does it belong to group books, I have a confession. I have had two books. I have book groups, and I had one book group for like 10 years now. And I never said, hey guys, you want to read my book? So definitely book groups. I think what's hidden in the stories, and you can say if that's true, is hidden subtly in the stories are references to historic events, to important current events, police brutality, slavery. There's a particularly poignant story that matches the story of a 90 some Black grandmother who is visited by a new graduate home care nurse. So there's an exchange in there that foreshadows the what happened to me and what happened at that visit of 3 days. I went to the Academy of, I was in the Washington, D.C. area, and able to go to a gallery, a portrait gallery, and saw a special exhibit on slavery. And it had a huge, massive photo of 20 some young black men who had been hanged on this massive tree. And I sat down and sobbed. It couldn't stop. But that's an example. And the keeper who was trying to get the doors closed, but not rushing me out. So that's a story of history that affected me deeply, affects many people, especially with the current rioting associated with police brutality. But those histories are sprinkled throughout the story. So that's why I think that book groups are a perfect place, because you have a group of people who've experienced, lived through those eras, perhaps civil rights, and they have something to talk about. And that's where we're at these days. We need people to talk to each other about their responses to events in life and so on. And subtly, I'm trying to do that. So stories are hidden through there and often dovetail that combine history, current events, and the various visits as well. So, so my book group next Thursday is getting a set of books. They all promised to buy one, and we're going to discuss the book. So, and I thank you very much, Joey, for helping me be more courageous in reaching out to others with the book. This has been great.
So I have to give you a shout out because I truly enjoyed that historical approach that you had in many of the chapters. And I was really in awe for several of them in the sense, oh, she was there when, oh, she was around when, and you know, the things that you were talking about. So it was a pleasure to read those. It was also a pleasure to learn from the people that you are caring for in terms of in those specific times. It's always good to understand and to know more about the history of that ethnicity, of that group, of that neighborhood, or whatever when you're a home care nurse. Those things are very important. And I see that being so relevant in your discussions with home care businesses and having nurses who are engaged in home care visits to really understand the culture of their patients. And I think sometimes that isn't taught strongly enough. And so there's a vision and a very wonderful kind of suggestion on your part, how wonderful and how more of a complete and comprehensive conversation you can have with your patients if you know the culture and understand the culture. And as you said, in many situations, you learned by asking questions. You didn't know necessarily going in, but you learned by asking questions. And I think that is wonderful for home care nurses wannabes, home care nurses newbies, understanding the importance of culture.
Well, and the newbies is a key word in that, because in this day and age, we are discombobulated, as Mary Poppins might say. But we, as in home care nurses, we question what we should be doing. Nurses are coming from the hospital. Nurses want to shift. They need to be mentored. They need to mature. That's my way of describing it. But it's our responsibility as strong home care nurses to take them under our wing, to tell them the stories, to let them read the stories in the book, make the connect. So, absolutely. We have to do that in the environment that we're living in today, and keep our nurses in their employment where they feel successful, where they feel they accomplished something. And I think quietly that can influence home health businesses and employers. Do they really know? Most often, wonderful people in the business world, but take time to understand what your staff are facing, how they're managing it. Excellent for nursing care managers, home nursing managers, because you can coach and mentor things that are going on that your new employee or your employee that didn't really have her heart or his heart in the practice of care. Although the book does say in the beginning, in the introduction, it is not intended as an introduction to home care as in a teaching book or as in a how to do this procedure.
Sure. So what's the importance or relevance of home care at this point in time from your perspective?
I think had started into that conversation and knowing we might go forward. I think it's important because it is. We will see very little. That's my prediction. But others in the public can even see that healthcare is changing. But where will home care, the physical visits that we know of, what will happen to them? Where will they go? How do we learn and manage, but most of all, create those streams that complement one another? When you do a telehealth visit, when do you need eyes on that person? What, I think we're going to find much bigger challenge to home care than we've ever imagined. And it has to do with this strange combination of telehealth, emergency room, hospitals that are overflowing, um, systems that are just so new or untested. So I think the book has a place, if not just for recreation, but it does because home care is what we must, as home care leaders, um, manage, coordinate, help go forward with the right solutions and the right genres is the wrong word, but the right types of home care. You know, how will you do such? And ask our new home care nurses, what are they seeing? In fact, I am recruiting home care nurse, the new ones or the ones that just came into it. You know, I saw all these people. What are they seeing now? What shall we be prepared? What shall we not? What's a black hole and what's not? And I hope to be able to do stories about the stories that the home care nurses are finding today, currently. This
Thank
is such
you.
a
Thank
pleasure.
you. Thank you so much, Sylvia. I so totally enjoyed the book, and I just really became committed to making certain that the stories be told and that your story be told. And I thank you so much for taking the opportunity and the time to join us and to talk more about this. Is there anything else that you would like to leave with us? Is there anything more you'd like to say about where you are and your next steps or anything like that?
Well, let's say talk to each other, tell your stories, got together, tell your stories, meeting together, and talk about the hard things. Talk about how it makes you sick when you go into a home where there's a hoarder and you go home and drop your sweatpants at the door because you have bugs and bed bugs. And so the hard things, because we are going to see homes, just given the current affairs of homelessness, we're going to see people that we're not going to be comfortable with, but we'll be the only ones to go into the homes to do that if our current model of home care visits is there, which it will always be, because people are going to be in their homes. Mr. As Kendrick said, as a futurist said, people are going to stay in their homes. and it's not always going to be pretty, but they have stories too. So I have a whole stack of things I want to do and want to write. I'm looking at doing Home is Everywhere as a series. So it would appear in, say, a periodical, or there's still technical ways of getting, like, to put it primitively, on Facebook. Like the other day, I released a Facebook post that says, help me celebrate a year since the book has been written. And I think about it all the time. When we had the storms not so long ago here in Colorado and everywhere, did a Facebook post about the storms, encouraging people who have the book or should buy the book. There's a wonderful chapter about weather and how, which prompts the question to readers, oh, how do those nurses get around when all the streets are blocked off because it's flooding? Or there's also a chapter that refers to Katrina. There's a chapter that is about a tornado, but it prompts the thought that this is what we're going to see, and this is what people see in their public life, but know nothing about how it affects the people who are at home getting health care. So that's the plans. I'm sure I'll dream of something else. I'm thinking already of another home care story. Ah, yes. Joy and I are familiar with this in the home care world. In the 1980s, there was a document, and there's a chapter in the book about this called Oasis. And it was a way that our payment system was going to change for Medicaid. So the University of Colorado, which continued its work in home health care studies and research, they decided to make a video, or a CD actually, of Oasis Health. So it was a video that would teach nurses how to assess a patient, and then it would go on to what the payment would be. But I was the subject matter expert for that. We partnered with a company in Virginia, chosen by CMS, to film 18 videos. And each one was about a particular question a home care nurse would have to answer. And the whole world of film, directors, the young man who's the director, he was a BBC correspondent. I mean, this was a world where I went, oh my gosh, this is a world. We filmed in bathtubs. And I had to create all the scripts for those based on what I knew as a home care. So I would tell the director and write the script, and he'd go and find the location. So we filmed at a flooded trailer. We filmed in a high rise for millionaires. We filmed in old rickety houses. We filmed on a boat. And it was central to my home care growth and experience, because I had to recreate in script what I'd experienced in real life. So I'm playing with that. Maybe writing something that can go somewhere. Maybe a sequel, right? Don't we all do sequels these days? Anyway, Joy, I've had the best fun. Thank you so much.
Thank you. I have also had the best fun walking down memory lane, revisiting some of my experiences. So thank you very much, Sylvia Talkington, for being with us today and talking about your book, Home is Everywhere: Adventures of an Itinerant Home Care Nurse. I read the book, as I said. I loved the book, and it drew me to Sylvia, and I'm so happy that we were able to meet, and we were able to bring this to you to give you more information. And I can tell you, as a little kind of a tickle, if you're into Oasis like we all are at Home Care, you need to read this book. just for that chapter if you don't go any further. There's many, many more, but the chapter on Oasis is thrilling and a reminder of what we've been through with Oasis. So thank you, Sylvia.